Fibrillation, the story of John. Meet John, a 65-year-old accountant who finds his job extremely stressful, especially during the tax season. He believes that his pay does not reflect the efforts that he puts into his work, which frustrates him even more. John's diet also primarily consists of fast food, and he rarely exercises. Being conscious of his health and body, John decides to visit his doctor. His family physician, Mike, asks him how he's been feeling lately, and John explains that he has been experiencing chest pain, shortness of breath, fatigue, dizziness, and he feels as if his heart has been racing. Based on John's symptoms, Dr. Mike decides to order an ECG. John, like many other individuals his age, is experiencing his first heart condition and is confused by the newly learned term, ECG. He has many questions he wants answered, so let's provide John with a little bit of information about his heart and ECGs in general. So let's assume John's ECG looks something like this. This is what a standard ECG looks like. So, what's wrong with John? In order to understand what's wrong with John, we will first review some basic cardiac physiology. The heart contains 4 chambers, 2 atria and 2 ventricles. The right atrium receives deoxygenated blood from the body and then pumps into the right ventricle, which pumps the deoxygenated blood to the lungs to become oxygenated. The oxygenated blood returns to the heart and enters the left atrium before traveling into the left ventricle, which will then pump oxygenated blood into the aorta to supply the organs of the body. Before returning to John's ECG, we should first take a look at what makes his heart beat. The SA node is the heart's pacemaker and is located in the right atrium. It produces spontaneous electrical signals that spread throughout both atria, resulting in atrial contraction. The signal will then continue to the AV node. The AV node will eventually propagate the electrical signal to the Purkinje fibers, which ultimately will result in ventricular contraction. The AV node has many purposes. Primarily, the role of the AV node is to slow down the electrical signals produced by the SA node in order to allow the ventricles enough time to fill. Should the SA node become dysfunctional, the AV node can act as a backup pacemaker for the heart, producing its own electrical signals. However, these are produced at a lower frequency of 40 to 60 beats per minute, compared to 60 to 100 beats per minute when the SA node is pacing the heart. Here's an image illustrating a standard healthy ECG. There are 4 main elements we wish to describe. The first is the P wave, representing atrial contraction and blood flow into the ventricles. Following this is the QRS complex, which contains the Q, R, and S waves and represents ventricular contraction. Ventricular contraction will eject blood from the heart. We then have the T wave, which represents ventricular relaxation. Also important to mention is the PR segment, which occurs after the P wave and just before the QRS complex. It illustrates the delay the AV node introduces, allowing the ventricles to fill with blood prior to their contraction. So what's wrong with John? John is likely to be diagnosed with atrial fibrillation. But what does this mean? Atrial fibrillation is defined as irregular and rapid atrial contractions between the rates of 300 and 600 beats per minute, far greater than your typical 60 to 100 beats per minute. This would greatly impact ventricular rhythm, but we don't see the ventricular rate of contraction increase as greatly as one would expect. This is because the AV node enters what is known as the refractory period, where no electrical signals can propagate to the ventricles. On John's ECG, you can see that there are no prominent P waves. This is due to the atria contracting so frequently that the electrical signals produced are not strong enough to yield sufficient P waves. So why might John have atrial fibrillation? For starters, atrial fibrillation is the most common arrhythmia. Its likelihood can be linked to factors such as high stress, alcohol abuse, and high blood pressure, which in John's case is due to having a poor diet and sedentary lifestyle. Also, the incidence of atrial fibrillation increases with age, and we know John is 65. So now, it's time for Dr. Mike to explain the situation to John. Dr. Mike explained to John that he has atrial fibrillation. Essentially, he told Mike that that means his heart's electrical signals are out of rhythm, causing him to experience his symptoms. Imagine 300 people are trying to get into a restaurant, or in this case, 300 electrical signals are trying to move from your atria to your ventricle. The AB node, or hostess at the restaurant, can only seat around 140 people at once, and can't let them all in at the same time. Whenever they do get through, they all enjoy the same restaurant experience, or ventricular contraction in this case. Dr. Mike told John not to worry, and told him that if properly managed, many individuals live long lives with atrial fibrillation. He did warn him, though, to be cautious, as atrial fibrillation increases his risk of stroke, heart failure, and diabetes, so it's important for John to improve his diet and exercise more regularly going forward. On top of his recommended lifestyle changes, John was prescribed medication to control his irregular arrhythmic heart rate. If his atrial fibrillation continues, Dr. Mike recommended cardiac ablation surgery for potentially permanent effects. He sees no reason John shouldn't live a rewarding, long life.